Oh, we're back. And now my guest is Nancy J., who is a home health administrator. You're the chief.
Yes,
or
sir.
The manager?
I oversee
Okay.
the 3 ancillary programs.
And these 3 that you oversee, you've assigned to various residents or various. How do you assign tasks to the 3? Begin with.
Well, the 3 programs are very distinct. So we have the Medicare Certified Home Health Agency, and that provides home health care by nurses, physical therapists, occupational therapists, and home health aides to residents in their homes who may be recovering from an illness, or they've been in rehabilitation and now they're coming home, and the rehabilitation continues when they get home. So that's the home health service. And the way that we get the referrals are from social workers, physicians, folks at the hospital when residents are hospitalized and are coming home. So that's how folks who need that service come to the program.
You work very closely with the physician who is assigned to a hospice. It used to be Dr. Cartmel. Who is it now?
Dr. Bethel is the hospice.
Dr. Bethel is the
hospice medical director.
So you work hand in hand with Dr. Bethel.
We do. We do. Dr. Bethel is also the medical director for the Certified Home Health Program. So she's a busy, busy, busy physician. And separate from the home health program is the hospice. So that's a Medicare certified hospice program. We serve about 32 residents a month, sometimes more.
Quite a responsibility.
It is, and the way that hospice referrals come to us again are through the physicians, mainly the providers, the physicians if the resident has gone to the hospital and it's determined that this resident may need hospice services, we'll get the referral right from the hospital.
I should also ask him or mention, you work closely with Reverend Lois Kraft also?
We do. The hospice team and the pastoral ministry team have actually partnered to help bring faith and spirituality in hospice care, bring the significance of those 3 things to residents. And to that end, I wanted to let the community know that we are actually going to hold 2 events in September with pastoral ministries and the hospice team, and it's called Spiritual Care and Hospice, Bringing Families Together.
So this is now part of the update information that you have.
Yes, sir.
So let's get specific. What are we going to do, we, Greenspringer, Erickson, going to do for the resident with this program?
With this program. It's an event much like it's going to be a conversation with pastoral ministry folks, hospice team, hospice nurse, myself, and families who have experienced the hospice services. So from the pastoral ministries, they'll bring the perspective of spirituality and faith to the conversation, and the hospice team will bring more of the services that the hospice team provides and the benefits of that. And then the families will bring their experiences to the conversation and discuss the impact that the hospice service had on their family member who was the patient, and then the survivors, those who live on after the death has occurred. It will be an opportunity for residents to ask questions of any of the folks that are going to be on the stage. It's going to be very homey-like. The stage is going to be set up more like a living room setting rather than tables, chairs, and that type of thing. And so it's going to be very much based on stories to help the residents understand the connection between your faith, whatever that may be, your spirituality, and the hospice services.
Hospice care and the health care.
Absolutely.
So this is a three-pronged program.
Yes, sir.
And it's going to be held?
They're two separate events. We wanted to have two separate events so that all residents will have an opportunity to attend one or the other.
Wonderful.
Sometimes we know that if you just have one date, one time,
people
are busy. So we're going to have the first event is going to be September 9th after dinner from 6:30 to 8 in the Village Square Theater. And you don't need to write it down. We're going to advertise it well. But I just wanted to let folks know that that's our first date. So that's September 9 from 6:30 to 8 in the Village Square Theater. And then the second event is a couple weeks later on September 30th, same time, 6:30 to 8, and that's going to be in the Garden Ridge Meeting Room. So residents will have the opportunity to attend one or the other, or both, programs, and family members are invited to attend as well.
Nancy, this is important enough that I would like to ask you to repeat times, places, and when.
Okay. The first event with Pastoral Ministries will be held on Wednesday, September 9th from 6:30 to 8 p.m. in the Village Square Theater. The second event is on Wednesday, September 30th from 6:30 to 8 in the Garden Ridge Meeting Room. So residents and family members are invited to attend one or the other or both.
That's important when you said and family members. So Mrs. or Mr. So-and-so can have their daughter come in and
Absolutely.
kind of help out the resident if the resident is somewhat infirm, if we will.
Absolutely. And also...
What a great program.
And to help the resident and the families understand what the needs of the resident and the wishes, most importantly, of the resident are, for when that time comes, as it will come for all of us.
Well, I want to pursue this just a little bit more.
Sure.
It's a three-pronged program. Will Reverend Lois be there?
Reverend Lois will be there.
Will Nancy J be there?
Nancy J will be there.
And Dr. Bethel for the hospice part, or her representative?
We haven't included a physician yet. Certainly that's an interesting idea, and I think that I will talk to Dr. Bethel about availability.
Yeah, I'm sure.
But it's something that we typically between pastoral ministries, and I want to mention Reverend Bell will be there as well. So it'll be
Reverend Jim
Lois, Reverend Jim Bell, myself, Kathy Craig, the clinical manager in hospice, Jane Jarrell, who's the registered nurse case manager who is well known to this community. She actually was the first employee hired by the community to open the hospice. She's taken care of many, many, many people on this campus.
You are really coming up with some very important information. Have we hopefully covered the programs, two programs now?
There's one more program we haven't talked about.
Okay.
If we have a minute left. It's the home support program, the Green Spring Home Support, which is another one that I oversee. That's our private duty agency that's here on the campus. And I just wanted to let residents know that in July, we had a record-setting July month. We provided over 18,000 hours of care to Green Spring residents, provided by the registered nurses, the certified nursing assistants, and our companions.
18,000 hours.
Yes, sir.
I'm sure my jaw dropped. That's a tremendous amount of visits.
It is. It is.
Speaking of visits, each visit lasts about what, 2 hours or 1 hour or half an hour?
So the aid services are scheduled by the hour. Okay. And the nurse visits are what's a visit. The nurse visit can be anywhere from 20 minutes to an hour. There's no set time.
Depending on
what needs to be done. So, it totally depends on what needs to be done. Probably, I would say the average nurse visit is about 45 minutes. Some are much longer, some are shorter. It's just, again, what the purpose of the visit is for.
What does the hospice aide do to make the resident feel comfortable? You know, he or she is, we'll say, suffering from dementia. What would one of your aides do to help him or her?
Oh, goodness. The hospice aide is one of the backbone of the hospice program. They're out there providing the personal care for the resident who may no longer be able to do so. They go above and beyond. They will take the resident, if they're still able to get out and about in the community, they may take them for a walk. They may take them to lunch. They do many, many things.
They take them to lunch?
They may accompany them to lunch.
Yeah,
But yes, they have absolutely done that.
Really?
Yes. The visit time for the home health aide and hospice is usually an hour to an hour and a half. And again, it depends on what the plan of care is for the aide, what she's to accomplish in that home each visit. But they go above and beyond to ensure that the needs of the hospice patient are met entirely within their scope.
Male that I am, I know that you ladies always like to have your hair done, and I assume that the home health person, the aide, will wash the female's resident's hair and set it for her, makes her kind of feel better.
Yes, they'll do their due. They'll do men's dues too. They really, looking good is just as important to feeling good. Sometimes it's your perception of yourself is very, very important. And the aides, the hospice aides and the aides in certified as well as home support really are very conscious of making sure that our residents being served look their best. They'll might prepare a light meal, a light breakfast if it's in the morning. Be sure that they get their nutrition.
Really? Wow.
Yeah.
Nancy, you have somewhat opened my eyes to what you and your staff does for the residents here. And I think that's amazing. I think also the programs that you mentioned earlier bears repeating before we close down this program. Now you're going to have 3 individuals representing hospice, health, and care, or religion. This is going to be held on September the 9th.
Yes.
In the theater.
In the theater.
6:30 to 8 o'clock.
Yes, sir.
And on September the 30th, same time, over Garden Ridge, with the same representatives.
Yes.
Before we leave, are there any other updates that you may want to impart?
The last one is that we did have for Certified Home Health, we had a presentation and panel discussion at the end of July, on July 30th. Great information was provided. Residents asked fabulous questions. I know that it was scheduled at the same time as a Christmas in July at the Treasure Chest. So, yes, we didn't do a good job checking that out.
You could have had a better attendance, is that what you're saying?
I am, but the great part of the whole thing is that Channel 6, the team recorded it, and so it's going to be rerun for residents to see on September 2nd and September 4th. Those are Wednesdays at 2 p.m. and 8 p.m. So any resident who missed that presentation and panel discussion can just tune into Channel 6 on the September 2nd and 4th at either 2 o'clock or 8 o'clock. And this will be advertised on the Village, on the Channel 6 scroll, as well as the TV guide.
Wonderful. Well, I think you have presented just about all of the updates out of your office, and all of them sound very, very important to me. And I'm sure it does to our viewers. So I want to thank you for being our wonderful guest this morning. and putting all this information in front of us.
Thank you, Bob.
Keep up the good work, my dear.
Always a pleasure to